Here's the numbers yesterday. This would be April the 16th, 2020, concerning COVID-19. I'm going to give you the facts. I'll let you think about what they mean, but these are the facts as of yesterday. Before I give you those facts, I would like to tell you I've created a switchboard to help with the treatment of COVID-19. It's free. There's nowhere it asks for a donation or any money to connect people who have recovered from COVID-19 so that their convalescent plasma can be collected and donated to help the survival rate of those who are still suffering with COVID-19. There was a Wall Street Journal article about this problem, about how the families of most seriously ill who are searching for plasma donors have trouble finding it because the paperwork that goes along with collecting it from the plasma centers can be time consuming, even if you can find a donor. So and a lot of small towns, there is no process for doing it. So this allows real time. Our website allows real time for people to, this is COVID-19 switchboard, real time for people who can donate for doctors to find those people. It's almost like a dating app. It is like a dating app. So just like you would do on eHarmony or one of those others where you just hook up for the day, this will allows people who are sick to hook up with donors so they can help each other. All right, so now back to the numbers concerning COVID-19 and what they actually mean. So let's look at yesterday from the world meter. And I like looking at daily new cases because the number of people I like looking at daily death rates because the number, not that I like that people die, obviously it's tragic, but for accuracy, the for the accuracy, the numbers of people with it and the number is going to go up as more testing is done. More testing means more people found that have no symptoms. If someone tells you they know the mortality of COVID-19 or have even a good idea about it, they either don't understand math or they're lying because until we do wide scale testing of asymptomatic people, which we are not doing, we don't know. To get hints, there was something like that done in Iceland, and somewhere around 50% were walking around asymptomatic who tested positive. We just don't know. If you a, I think encouraging fact is if you look at actual the flu numbers, last on the average around 40,000 people per year die from the flu. The ranges, this is in the United States alone, 12,000 to 61,000 people per year die from the flu. Well, that's with a vaccine. We have no vaccine for COVID-19 and no herd immunity, and 30,000 people have died. That's a horrible number, but that's less than the flu half the time. And there's no vaccine for it. So one could make the argument from that it's actually less dangerous than the flu. We don't know that, but that's a logical conclusion that could be made from those numbers. Another fact, last year my father went to the hospital with the flu. His across the street neighbor died from the flu. His next door neighbor died from the flu. He's in a community where there's a fair number of retired people. And you can see the rate, somewhere around 50,000 people died from the flu, but no one closed down everything. And obviously, I'm not saying we've overreacted. Maybe we didn't. Maybe we did. We don't know. That's just it. We don't know until we know the mortality rate. We did the safe thing to shut things down until we figure it out. But no one really knows if this is going down from social distancing or if it's just wearing itself out like every other pandemic does. We don't know that answer until we know the mortality rate. It is tragic. But again, I want to point out I'm not downplaying it. I actually spent a week and some money developing a switchboard to help people get well, from it. But let's get back to the numbers. If you look at these numbers on this diagram, and this is from yesterday's numbers on the 16th of April, except for this one outlier, this curve is following exactly the same curve that was followed in Spain, Italy, China, every place it's been looked at. It goes up and it comes back down in about 20 to 30 days. That doesn't matter whether the social distancing was largely ignored or not, or if you're in a town like someplace in China where you're going to social distance or you might get shot or locked in your house versus someplace where it's less strict. Either way, it lasts about 20 to 30 days and it's gone. Again, I'm not saying that it didn't help. Sure, it helped. I'm just saying that that's the rate. Now, the height or the length of it, the height of it is probably different in, than what's been reported. China probably lied. You can't have a communist country and not lie, in my opinion. Okay, that was a social comment, but that seems to be the history of communism. You have to lie. So the height was probably much different, but the length we're pretty sure about because we know when they close the city, when they reopen the city. So the the highest part of that curve is about 20 to 30 days. Now, if you look at the United States, it's coming up, and you can see looking across here, it's leveling off. You can see that picture better over here on the website, and I'll put a link to this website on the web page. But if you look at the United States daily deaths, you can see it actually came down most days for 7 days. It went back up, but they changed one thing that changed here is they began to allow people to diagnose COVID-19 with actually doing the test, just to go back and retrograde diagnose it on the death certificate. There's no other infectious disease where that's done, where you just get to guess. But you can't make up a dead body. And so even though these numbers made a sudden jump, they've started to come back down again in alignment with this curve as there's fewer people to reclassify as unknown as testing has become. In other words, people who are already dead got retrograde labeled as having COVID-19 here without doing a test. Whether that caused this outlying number or not is speculation, but it did temporarily coincide with that redefinition, and then it came back down in line with the curve. So I don't know, maybe it jumps back up here and goes crazy and we all die. But so far, this curve is exactly in line with what's happened in the other towns. So now if you go back and look and you plot that out, it still goes away or goes way down by around the 1st of May. People will keep dying. They'll keep dying from lots of things, including COVID-19. So to help you put that in perspective, let's look at some of other numbers. Again, averages 40,000 per year from the flu. So far, 30,000 have died from COVID-19. Yesterday, you can see somewhere around 2,000 people died from coronavirus yesterday, April the 16th. Also yesterday, drunk drivers killed 30 people, 3,200 teenagers committed suicide, 3,700 babies were aborted. No matter what your position on abortion, nobody likes that number. 42 people were murdered, 3,100 people got divorced, 16 million adults suffered with major depression. Yesterday, 1 million people were living with HIV. Yesterday, one person died every 37 seconds, or 2,335 people from heart disease. Yesterday. So I'm not saying it isn't tragic. I want you to see that I mean what I'm saying by the fact that I've spent some time building something to help people get well. But I think that there's a lot of other tragedy in the world. And when you look at other pandemics, we're not all going to die. There's never been a pandemic that didn't burn itself out. Well, people just had to go huddle in their houses the rest of their life and worry about germs. You worry about all germs. You worry about all these other things. This won't be the last pandemic. Imagine being in the 50s when the germ was the thing that was going to make your baby get put in an iron lung or be on crutches. And people didn't go hide in their houses. They went to school, and grandmothers did things like keep the house aired out and sunshine in and the windows open. And now we have studies showing that that helps you stay healthy. They did things like sleep and eat vegetables and try to keep healthy by exercising and all those grandmother things that help you stay well that I'm not going to talk about now. But in the end, the government can't make you healthy. That's your responsibility. And imagine the mothers of children with cystic fibrosis, where you know your baby's going to have to battle pneumonia and possibly get on a ventilator. What do? They start training their children to be healthy. They physically train them. They do things to make them be healthy because they know it's coming. This is what I will promise you. Even if COVID-19 magically disappears tomorrow, you're going to be around germs. You're going to have germs that could kill you. The bacteria around your anus could kill you if you got enough of it in your bloodstream. You can die from germs. You know what I really think has happened? Okay, I said I wasn't going to do it, but I'm going to tell you anyway. This is not a number, this is just an observation. Suddenly, all at one time, this is a good thing, by the way, massive worldwide acknowledgement of our mortality. And germs can kill us. And drunk drivers can kill us, though, and heart disease, and a freaking rock falling off a cliff. I actually saw that on the news where people were hiking and a freaking rock fell off a cliff and killed this lady out hiking. You're going to die. And so what should you do in my opinion? Do what your grandmother told you to do. Stay healthy, go have sex, go to work, read a book, hug your babies, sing a song, and live your life. And that's probably enough. Hope that helps you.